Bob and Brad, the two most famous physical therapists on the internet.
Hi, folks. I'm Bob Schrupp, physical therapist.
Brad Heineck, physical
And
therapist.
together we are the most famous physical therapists on the internet and on the floor.
And in our opinion, of course.
We're going to show you how to do some hip mobility exercises today, probably 10. And we're going to show you some new ones at the end of today's session.
Yeah, I think these are brand new
I think so.
in the world.
Nobody in their right mind would come up with these.
We'll find out.
You want to show what our giveaway is, Brad?
Yes, the giveaway that we are going to give away is our wall anchor, which here's a model of a wall anchor here. And we're going to show how you use it in just a second. But the only thing about the wall anchor, you need to have a wall that has wooden studs behind it. And they work wonderful. There's a screw that shows how deep it goes in the wood. And there
that
it
shows
is.
the screw that missed, too.
Well, no, I missed on purpose,
Yeah,
Bob.
right.
So, yeah, here we go. Look at this. We've got all kinds of levels. You can even do them down here on the floor. Put it on here
There you
and
go.
do your curls. If you got the large loops, no problem.
They're very, very handy.
Yeah,
They come in, if you're going to work with bands, you should get some
You
wall
will say, how did I ever do bands before?
Right.
There's so many, opens up so many options.
So go to Bob and Brad, go to the giveaway section. You can sign up for it. This week, we're going to give away one to the USA,
Yep,
but also one internationally.
right.
Because you people never get to participate in these giveaways. So
And we care about everyone in the
right.
world.
That's right.
And you get 4, not just one of these, but you get 4 anchors with a set. So very good.
All right.
Bob, what do you say?
Let's start off with we're going to start off with the 90 position.
Ooh,
So both knees are 90 degrees. And when you're in this position, a right angle, you look confused, Brad.
Well, Bob, I wanted to let everyone notice that my socks matched
Oh,
the
God.
pull, the stick.
Lordy. All right. So when you're in this position, you can actually try to rotate towards the back leg, and that's where you're going to feel the stretch. You feel it, Brad?
Yeah. This one kind of bothers my back a little bit, so I'm just going to kind of gently work it. And that's because my spondy. And
that's always the case.
There may be other people I have similar.
Right.
It shouldn't create pain in the back.
Now, before we switch to the other side, Brad, I want to actually do the pigeon pose.
Oh,
So
yeah.
You can actually get up on this leg and bring this leg back and then start working on external rotation of the front hip.
I'm not doing it. Your foot's right in my face.
All right.
I did a whole video on this once, Bob. I did some pretty thorough
All right.
research.
I'm going to go back to the 90. Now I'm going to bring my legs forward like this. And this is the bear sitting position. I guess this is how a bear sits.
Where they come up with these names? Oh, it's a nice one. I'm getting some hamstrings in here.
And hamstrings go across the hips, so we
Yep.
need to make sure they're taken care of.
If you get wider, a little adductor.
All right.
Good general stretch.
Now I'm going to go into the right 90 position.
Oh, yeah. We want to make sure we get both directions.
90 degrees. Oh, yeah. And I'm going to try rotating back. Brad's not going to because that bothers his back.
I can go a little bit, but I'm not going to be aggressive.
Right. And that's how we all want all of you to be out there.
Right.
I mean,
we
don't
want people
cause pain.
Yeah, we want you to feel better.
All right. Then we're going to the pigeon pose.
Oh, the pigeon again.
Yep.
Oh, yeah.
Now, this one is not only stretching the front leg, but it's also stretching the back leg into extension.
Boy, if you go up like this, you get a little different taste. First is down. Oh, my goodness, Bob. This is not one I do on a regular basis. I think maybe I should consider it.
Yep, I've been starting these. Actually, now we're going to go into a quadruped position. And I don't know if this is called the frog legs but you're trying to keep your heels apart.
So out this way.
Yep. And try to sit back.
Whoa! We both got her there.
It's a bad one.
Yeah, this is fun. If my wife could see me now. Holy cow.
This is a tough one.
Oh, my gosh. Oh, my kids aren't watching.
Someday I'd like to see my butt on the ground with that one.
Nobody wants to see your butt
Yeah.
anywhere.
All right, next one. These are some of the new ones now. You're actually going to have a 5-foot pole, like a dowel would work. A booyah stick obviously works really well.
Yep.
So you're going to work on external rotation. So the pole goes on the outside of the ankle, but the other part of it goes on the inside of the thigh. It's just best to show up, right, Brad?
Yeah. So.
And now I can really stretch this down into abduction.
So the purpose of the pull is just to give you a little leverage.
Yep. Oh.
So
Keep your butt down. Keep
this
your
is
shoulders
a family show, Bob.
Yeah.
People are going to talk.
Right. All right. Now you can flip it around and actually do the pull on the inside of the ankle, the outside of the thigh, and really, again, keep your shoulder down and really work on internal rotation of the hip.
Yeah. Now look at from this angle. Don't look at Bob. Look at me. Look at this. That's all internal rotation of the hip joint and the femur. You really, this is a good idea, Bob.
Yeah, this one you can crank on.
You should patent this.
Yeah, I will.
Okay.
Trademark at least.
Yep, absolutely.
So next one, we're actually going to work on hip flexion. Very simple. Put it underneath the knee and really crank on it. Now you could grab onto the knee, but some people can't reach it.
Right. Yeah. I'm doing the old get my elbows in there.
Oh, that's a good idea.
It's kind of fun. Wave at yourself.
Oh.
You can work that knee along with that a little bit.
All right. Why don't we finish up, Brad, with yours, the cross-legged pull. You know which one I'm talking about?
No.
This one.
Oh, yeah.
I named it. The cross-legged pull.
Okay.
So
I'm trying to figure if there's a stick way. There we go.
So with this way, Brad, actually, can you show how you use your elbows to push the legs out too?
Yep. So Bob crosses his feet. You could do that, or put
you can keep it together.
Feet together like that.
Actually, do both ways.
Yep. Grab the ankles, pull your ankles towards you, and your elbows push the knee out. And boy, does that do a nice stretch. I use the stretch out strap right here, or the stretch strap. That works actually a little bit better, but you don't need one. If you have one, go ahead.
This is kind of backwards today, but I'm going to mention some of the reasons why you want to do this.
Oh, yeah. Why, Bob?
When you have more mobility in your hip, you generally have less pain.
Right.
Especially with arthritis.
Increased range of motion typically results in less pain.
You won't do this after a hip replacement, though.
That's a good point. You know, Mark Cook, the doctor, he writes down just getting down for people, 50 and over, getting down, sitting on a hard floor, carpeted floor is just good mobility in
Kelly
itself.
Starrett says that too.
Yeah. So there you go. We got experts.
He says in Japan, they all get on the floor. And that's, why they stay younger.
Yeah, because, plus, if they sit in this posture, it promotes good posture as well as gives some mobility.
Hip exercise too, isn't it?
Yeah, there you go. Oh, there's so many things to learn yet, Bob.
The other thing is, if you have a good hip mobility, it's a lot easier on your back.
Oh,
because we want the movement to come from the hip, not the back. We don't want you rounding like this. Keep the back straight, and you hinge at the hip.
Yeah.
So
the hips are the center of gravity, Bob.
They are, and the center of your motor power.
Yeah.
Really.
Actually, in Aikido, they say it's just 1 inch below the belly button.
Yeah, I think they're right.
Yeah. Well, there's no doubt about it.
All right.
Move from the center.
Thanks for the info, Brad. All right.
Take care.
Take care.